Hello, my name is Hadi Erfani, a PGY2 in obstetrics and gynecology at Baylor College of Medicine in Houston, Texas. The title of my presentation is a longitudinal study of the adherence to PORTEC-1 based adjuvant radiotherapy in high intermediate risk endometrial adenocarcinoma and associated oncologic outcomes. I have no conflict of interest to disclose. Intermediate risk endometrial adenocarcinoma is defined as a stage 1 endometrial cancer with grade 1 with deep endometrial invasion, or grade 2 with any invasion, or grade 3 with superficial invasion. PORTEC defines high intermediate risk disease as presence of two of the following: age more than 60, grade 3, myometrial invasion of equal or more than 50%. In 2000, Kreutzberg et al. Reported a on PORTEC-1 clinical trial. PORTEC stands for postoperative radiation therapy in endometrial cancer. In that study, they randomized patients to adjuvant whole pelvic radiotherapy or no additional treatment or observation. And they concluded that whole pelvic radiotherapy reduces the risk of local regional recurrence compared to no additional treatment in high intermediate endometrial adenocarcinoma. Postoperative radiotherapy, they suggested that it's not indicated in patients with a stage 1 endometrial carcinoma below 60 years and patients with grade 2 tumors with superficial invasions. The aim of our study was to study the adherence to PORTEC-1 based radiation regimen and also to report the oncologic outcomes of patients undergoing PORTEC-1 adjuvant regimen. We use the data from surveillance epidemiology and end result program of the National Cancer Institute between the years of 2005 and 2015. The inclusion criteria was all patients who underwent hysterectomy with bilateral salpingo-oophorectomy and the grade 1 with more than or equal to 50% myometrial invasion, or grade 2 with any myometrial invasion, or grade 3 with less than 50% myometrial invasion. The exclusion criteria was if any lymph node involved, if any lymph node was examined, if any chemotherapy was received, and if any outcome variable was missing in this national database. The intervention group was the group who underwent whole pelvic radiation therapy, and the control group was the group who received no additional treatment. The primary outcome for this study was adherence to PORTEC regimen, and the secondary outcomes were hazard of overall mortality, hazard of cancer-specific mortality, and overall survival months. Appropriate statistical analysis was done. Statistical modeling was performed using Cox regression analysis. A total of 1,449 patients met PORTEC-1 inclusion criteria. 349, or 24.1%, received whole pelvic radiation therapy. And the median follow-up was 6 years in those who received radiation therapy and 5 years in those who received no additional treatment. The p-value was 0.06. Our study showed that there's unfortunately a slow decline in the adherence in following the PORTEC-1 adjuvant regimen, 27.9% versus 23.7% adherence rate in 2005 versus 2015, and that was statistically significant. This table shows the characteristics of the study subjects. And this table shows the survival outcomes of the study subjects. As you can see, as a result of the Kaplan-Meier analysis, we found out the overall survival and also the cancer-specific survival is higher as the group underwent whole pelvic radiation therapy. Cox regression analysis revealed a 29% decrease in the hazard of overall death in the whole pelvic radiation therapy group, and the hazard ratio was 0.71 with 95% confidence interval within statistical significance. And the statistical model for cancer-specific death was not statistically significant, however. Our study concludes that significant decrease in the hazard of overall death and PORTEC-1 regimen is observed compared to no additional treatment. And we also showed that the adherence to PORTEC-1 regimen is slowly declining over time. Thank you for your attention, and I'll be happy to answer any question on the comments. Thank you so much.